Hello, dear listeners. Welcome to another episode of Follow Your Path. My name is Abdul Abid, and today we will be talking to Dr. Erin Barnhart. She is the Chief Medical Examiner for Galveston County in Southeast Texas. And as usual, my co host Meredith Herman joins us. Welcome to the show, Dr. Barnhart.
Hi, thanks so much for having me, guys.
So, starting off, can you please tell us about yourself, where you grew up, where you went to medical school, and how did you end up in forensic pathology?
Sure. So, like Abdul said, my name is Erin Barnhart. I grew up in North Texas, in Fort Worth specifically. And I went to TCU there where I got my bachelor degree. And I then went to medical school down in Houston at the University of Texas Health Science Center, which is now confusingly called McGovern Medical School, but it's the same place. Um, and then did residencies in anatomic and clinical pathology at the University of Texas Medical Branch in Galveston, which is just south of Houston, just down the freeway a bit. Um, and after that, I completed a subspecialty in forensic pathology in Miami, Florida, at Miami-Dade County Medical Examiner's Office. And then I returned to UTMB for a second fellowship in surgical pathology. Uh, One or more fellowships is not terribly uncommon in pathology. It does happen. Um, I then, my first job was serving as Deputy Chief Medical Examiner for the state of Mississippi. I was there for over 4 years. Um, and then began to be recruited back to Galveston, Texas by UTMB to serve as their chief medical examiner. And I was super excited to take advantage of that opportunity. And so I've been back here since 2015.
That's amazing. And I'm sure you had a wonderful experience, all the places you've gone and learned so much. And just kind of segueing from that, was there a particular faculty member or mentor that inspired you along your career path?
Yeah, so I think the answer to that is yes and no, interestingly, right? So, in medical school, and I know a lot of your listeners are medical students, in medical school, there's not a lot of exposure to pathology, and there's very little exposure to forensic pathology. Um, the reasons for that are, I think a few fold. So, for starters, forensic pathologists are not usually physically or otherwise located within academic institutions. So even if a med student may be interested in forensics, they may not have access to that person. That person is generally going to be in a medical examiner's office, which is going to be a city, state, county building somewhere. I think also med students have less exposure to pathology, as we know. It's not one of your primary clinical rotations. And so if you do want that experience, you're going to have to be a little bit more proactive about seeking it out. So in medical school, I don't know that I really did have a particular mentor. Once I came to UTMB for residency, UTMB is kind of uniquely positioned among pathology residencies because it has a very robust autopsy service. A lot of academic institutions don't. Now, if you're a resident who really hates doing autopsies, that may not be the best thing in the world for you, right? But if you are interested in it, it's a really fantastic opportunity. And the autopsy faculty at UTMB, I think, again, in contrast to many other training institutions, are really passionate about autopsy service. And so it's not like, oh, well, here at this institution, we have 4 autopsies a month, and the faculty kind of rotate who gets it, and then they kind of grumble about it, and that's that. I mean, these are autopsy faculty level pathologists who have been doing this for years. They've done hundreds of cases. They have a lot of experience with natural disease processes, of course, but also with some forensic aspects of autopsy. And so as a resident, I was exposed to more forensics than the average resident. To drop a few names, Judy Aronson was really integral in my training. Dr. Alano was consistently supportive of myself and the others of us who were interested in forensics. I think in a lot of training programs, it's kind of discouraged. It's a bit maligned, again, just because the faculty members that you're talking to don't have any experience with it. But that was an interest that was really fostered where I went, and I consider myself very lucky. And in terms of mentors, let me say something else about that, because I think talking about medical school and faculty influences, something that I realized at that point in my training when I was still trying to pin down what I wanted to do, right? So obviously, what field are you interested in, right? Like, what's your scientific niche? Do you like kidney stuff? Do you like surgical stuff? Can you not understand hematology to save your life? I mean, these are all the things that are going to influence what you go into. And then you think about lifestyle factors, right? And among those lifestyle factors, I noticed, I wouldn't have said anything really or spoken about it at the time, but my advice would be to watch your faculty members in med school and really notice, are those people happy? Do they seem to like their jobs? Are they mad that they're at work? How do they treat people? And I think that will also can give you a kind of a bit of a clearer indication of, what is this lifestyle going to mean for me? And so in med school, while there maybe wasn't one particular faculty member who I really thought, oh, I want to be just like them. One thing I did notice was that the pathology faculty, they just seemed happy. they seemed like a happier group of people. They seemed pleasant. They were friends with each other. They seemed to have other stuff going on in a good way, right? And so I thought, that's something to pay attention to, right?
Yeah, that's wonderful. Yeah, that's a very wonderful observation. I think I would endorse that, the similar feeling about pathology faculty. So moving on, and I know a lot of people that I personally know have already decided on forensics before they even come into pathology. But let's say if someone is not decided about that, what would you tell a medical student or a junior resident? What makes forensic pathology unique?
So a lot. So immediately off the top of my head, forensics is going to have a lot of overlap with the legal profession and is going to have a significant amount of contact with law enforcement agencies at every level. So what this means is that you're going to be in contact with those people regularly. What you trade off with that is that you're not having regular dialogue with the patient, right? So who you are communicating with on a daily basis is different. So, versus your patient who you're interviewing, during your clinic visits or post-ops or, getting your H&Ps or whatever, you're going to be talking to other people, and they're going to be people who are in other professions. For the most part, most of the time, that's a really mutually beneficial, really respectful, really interesting relationship. I enjoy it immensely because I get to learn about other things besides just medicine. And I think that feeling is generally reciprocal. So again, you have contact with folks in other fields. Also, your patients are a lot different, right? So the patients that you're dealing with, fundamentally, these are my patients. I'm going to be their last doctor. I'm delivering important information about them, hopefully valuable information. But the model of that is really different, and that can be a really good thing, actually. So we're not RVU based. I don't have clinic spots to fill up. My schedule is not being managed by an administrator. I keep my own schedule. What my day looks like is going to some degree, be a surprise to all of us, right? So there's actually a lot of freedom in that, right? So if we have a few cases to get through during the day, when those cases are done, I can kind of determine that. If one case needs a lot more time, and the others can be done more quickly, we can arrange for that as well. Is there something that I'm going to need an extra level of assistance with or extra information? I have the freedom to take the time for that as well. So within the US payment model, at least, forensics is uniquely free of a lot of those things that tend to kind of grate on doctors, right? They tend to be a bit of a beat down. And so we are, for better or for worse, and I think most of the time it's for the better, are not beholden to those requirements.
Thank you for sharing all of that. And forensics is truly a unique niche in pathology. And there's lots of great opportunities for students to explore that more throughout medical school and for residents to get exposure. Can you share an interesting case with us, something that you've come across in your time as a forensic pathologist, something that's stuck with you?
That's always the hardest question. And it's also the most common question, right? So I know it's a common question for really any doctor. And I think the assumption is that when you ask a forensic pathologist about their most interesting case, it's going to be the case with like the most injuries, the craziest story you've ever heard. And don't get me wrong, I do have a few of those. We don't have time for it here on this podcast. But I think, and those are certainly cases I remember, but I think rather than, focusing on those types of cases as the ones that have been most impactful for me, I think the cases in which there is an important lesson for the way that I practice are probably the most valuable. I mean, a few examples would be, obviously, when a person dies truly unexpectedly, right? And the reason that they died is really an utter mystery. Being able to answer that question, solve that mystery, give answers to the family, is really hugely beneficial. So, off the top of my head, I'm thinking of a young woman in her mid-20s who had just had a baby. So her baby was only a couple of months old. She's found dead at home. Obviously, the family is completely devastated, trying to figure out what this means for their family and for her infant child. Somebody in their 20s dying, usually you're going to think, high suspicion of drug abuse, for example, but she really didn't fit that profile, right? And it turned out that she had an acute coronary artery dissection. So it's no less tragic, right? But it is a really definite, really clear reason that she died. And it was related to her pregnancy. It was related to the fact that she was a new mom. Again, super tragic, but something that we could give her family to answer that why question. I think also another case that I think of kind of immediately was a case of an infant death. For those of your listeners who don't know, the instance of infant death in the absence of things like congenital problems, genetic diseases, or trauma, child abuse, which we obviously all are a bit familiar with. There's a category of infant death that we kind of consider generally are called undetermined. Now, used to, those were called SIDS. Before that, they were called crib death. But they're cases of infant death where you basically do all the exams and everything's negative, right? So there's no congenital disease, there's no infection, there's no neoplasm, there's no injuries. You look at everything under the microscope, there's nothing there. You interview the people involved, and there's really no rhyme or reason. And this happens, unfortunately, more often than we think. And so I had a case where this had happened. That was the case. The baby was 6 or 7 months old. And then in just a pure stroke of luck, or whatever you want to call it, the mother came forward and confessed that she had suffocated the infant. And this was after, several months after I had already completed my final report and called it indeterminate. She explained why she did it. She explained how she did it. She obviously had some mental health issues going on. And so ultimately that investigational information, that circumstantial information, I felt was strong enough for me to go back and amend that report with that investigational information and ultimately call it a homicide. Now, I don't know that there's anything terribly interesting or life affirming about that. However, there's a really important lesson there. And in any case like that, where you have, where there is some degree of unknowing, right? And the lesson is about humility. It is about knowing the limitations of what you are able to determine. It's about knowing the limitations of the information available to you. And it's about really being comfortable saying when you don't know something. And I don't think that just applies to forensic pathology. I think it applies to all fields in medicine. When you are uncomfortable not knowing something and you maybe start to, fudge a little bit, right? Or maybe be a bit more confident in some way that you shouldn't be, that's a really slippery slope. And I think as long as you stay humble and are comfortable putting it out there when you're at your limit of what you can do and of what you can say, I think ultimately people are going to respect you for that and people are going to understand that.
Wow. Yeah, that's I think humility is a sign of I would say all great pathologists and obviously clinicians as well. That's definitely. So just moving on to a little more, I would say changing a little gears a little bit. What is the most gratifying aspect of your job? What makes you most happy in your job?
Oh, I think so. Really getting that answer, right? That nobody knows, and the fact that I'm the first one to see it, that's always a little bit of a rush, and everybody else is waiting to hear, and you get to be the first one to see it, and that's really gratifying. I think any part of my job where I'm able to sort of, even when I'm really busy, and in fact, it probably happens more easily when we are really busy, anytime where I can sort of get into the groove, get into a groove, that elusive flow state, right? I think anytime when you can sort of hit your stride, even if you're really busy and feel like you're kind of locked in, and getting the work done, and you're in you're clear-headed, and going through your differentials and knocking stuff out is a really satisfying feeling.
Absolutely. And another changing gears here as well, for the people who are listening, interested in forensics. Can you touch on what the training is like and how to go about getting into forensics?
Sure. So under the umbrella of pathology, anatomic pathology is a 3-year residency. Clinical pathology is also a 3-year residency. However, if you do both combined, which I think is still what most people do, it's a 4-year residency. So you do either a 3-year AP residency or a 4-year combined anatomic and clinical pathology residency. So that at most is going to get you to 4 years. You do have to do a fellowship in forensic pathology. It is a board certified subspecialty. So you do take an exam, a board exam at the end of that year. And that is only a 1-year fellowship. Some people in pathology do 2 fellowships. I did. To be totally honest, I did that because coming out of my forensic fellowship, there really wasn't a job that I wanted. You do not have to do 2 fellowships to do forensic pathology. You really just need that forensic specialty. So depending on what you're doing for residency, you're looking at 4 to 5 years post medical school.
And can you touch on some second fellowships that might complement forensics very well?
Sure. So there are those that will do, they usually do them after the forensic fellowship. Neuropathology is one example. Those two fit pretty nicely together. Pediatric pathology is another one that can be a nice complement to forensic pathology. And of course, surgical pathology is a great fellowship to get under your belt. It can help you with a lot of different things. It may be that some of the more emerging specialties like molecular diagnostics, depending on where you work, if you are in a medical examiner's office that's affiliated with a large crime lab, that might be something that could work out nicely as well.
Oh, great. So last question, what advice would you have for residents who are interested in the specialty? What should they do during their residency to sort of prepare them for a career in forensics?
So I think get exposure to autopsies. And I know pathology residents should have exposure to autopsies, but you may need to make more of an effort to seek that out. You obviously want to make sure that you're comfortable with that, right? That's what you're going to be doing a lot of. If it's something that you really, really dislike, if it's something that bothers you emotionally or physically, if you find yourself, not being able to turn that off, if you find yourself losing sleep over it, that's probably not the profession for you. But seek that out, make sure that it's something that you're comfortable with. See if you can find a faculty in your residency program that is supportive of that interest. If not, you can reach out to medical examiners. My situation's a bit unique because I'm a county medical examiner. I'm a governmental appointee, but I am an employee of an academic institution and am on staff there. So we do have medical students come and rotate with us. We have a medical student, for example, coming to visit with us tomorrow. She just emailed me out of the blue and said, I'm interested in forensics. Can I come hang out? I said, sure. So you can still do that, with a medical examiner's office and see if maybe that might be a possibility. Please don't watch the TV shows and decide that way. That's not the best way to decide. I know that probably comes as a surprise, but and then when it comes time for you to choose a residency that is supportive of forensics and that will get you that exposure.
Nice. I actually, now that you mentioned, I gotta ask a bonus question. If you had to choose between like TV shows that are closest to or the most true to like a forensic profession, would you choose any?
So full disclosure, I don't watch a lot of TV at all. And if I were to watch TV, the forensic shows would not be first on my list. They do have kind of, the true life, shows that are kind of recapitulating the autopsy exams. Those, of course, are all staged. Dr. G Medical Examiner is one that comes to mind immediately. If you have a lady doctor in the morgue supposedly doing an autopsy and she's got her long hair down, I mean, that's a pretty good indication that it's not real, right? What else? I do think there are maybe some pretty decent podcasts and whatnot, not that necessarily deal specifically with forensics, but that do look at both forensic law enforcement and legal aspects of certain cold cases. I think those can be pretty interesting. And regarding the legal side of what we do, it's one of the most important things we do. It is not something that there's specific training for. It's something that you learn on the job. It's something that you can learn and pick up. But having said that, you do have to have a certain degree of comfort speaking in public, potentially speaking on camera and things like that. And you do need to have, some degree of comfort speaking to a jury because you're kind of acting in that moment as their teacher, because the lawyers aren't going to be able to do it. And so, that's if that's something that you say, oh no, I could never get up there and talk. I would just, pass out or have a panic attack. Again, that's something that you can learn to a degree. But if it's something that the thought of truly terrifies you, that may be another indication that it might not be the best fit.
Right. All right. Thank you very much, Dr. Barnhart. So that's our show today, folks. Thank you very much for listening to us, and we'll be back with another episode soon.